So our next speaker, I'm very excited, is my friend, Dr. Eddie Maristany. Dr. Maristany is a board-certified internal medicine physician and Institute of Functional Medicine certified practitioner. IFMCP is vetted through the Cleveland Clinic. Dr. Maristany is licensed to practice in Florida, Georgia, New York, Illinois, Texas, on and on. He's awesome. Colorado and California. Dr. Maristany's post-residence training includes functional and integrative medicine, advanced personalized genomic interpretation, environmental detox, immune and inflammatory diseases, neurologic chronic fatigue and fibromyalgia, and other chronic debilitating illnesses as well. Please allow me to introduce Dr. Eddie Maristany.
Thank you again. Made me sound great, man. I appreciate it.
You're awesome. Welcome.
Good morning, everyone. Hope you guys are enjoying the weather here in Orlando. It is just so perfect outside, so hopefully everyone goes outside today. I'm here, to talk about long COVID and if COVID is actually still a thing or not. COVID was obviously a pandemic in 2020. Here we are in 2024. Does it really matter now? Is it really causing a huge effect in our economy, or is it a thing of the past? As I was just introduced, which was a great introduction, I did get classically trained in internal medicine. I was an associate professor for Mercer University for 10 years. I had a tail of medical students and residents and pharmacy students in the hospital setting and academic hospital. Academic medicine is my passion. But in addition, there's a good saying, if you guys have ever seen the movie Anchorman, they reference a perfume called Sex Panther, and they say, well, 60% of the time it works every time, which is one of the most classic oxymoron quotes of the 21st century. But in internal medicine, I think it's the same thing. 75% of the time it works every time. So what about the 25% for which it does not work? What can we do for those patients? The Cleveland Clinic set off to create a new type of medicine where we use personalized genetics and environmental exposures to figure out why the 25% are not responding like the 75%. It's really fascinating. So let's talk about COVID a little bit here. Now, there's been 140 million people that have had COVID, that we have tested positive for COVID. Every other person who got COVID who never got tested. So it's a safe bet to say that probably 80% of the population had COVID at one point. 11% of those people that we have documented went on to have long COVID by the CDC's long definition. That's pretty disturbing. That's 1 in 10 people. And if you think about that, that means 1 out of 20 people in the United States, at least, have had long COVID. So what are the common symptoms? The most common, as everyone probably has experienced, is extreme, devastating fatigue. People that have COVID are in the bed for 5 days, even with a mild case. They can't move, they can't function. They're ordering an Uber Eats, they're just doing nothing, right? Well, what if that persisted? What if you had fatigue that was so persistent that you couldn't function, you couldn't work? That's what we're seeing now. So that's a huge percentage. But also, brain fog. 80% of people, up to 80% in different studies. So think about that. Are we seeing more car accidents now? Are we seeing more errors? Is it from brain fog? Is it from long COVID? What else are we seeing? Are we seeing worsening Alzheimer's? Could that be from long COVID? So these are questions that we have to ask ourselves, and we still need more research to prove this. Look at this, guys. Anxiety and depression, 25%. 1 out of 4 people that have long COVID experience debilitating depression or debilitating anxiety. These are really concerning because when most people experience a little bit of depression or a little bit of anxiety, they don't report it. They only report it when it's significant. Anyone who's going to tell their doctor, I have anxiety or I have depression, it's because it's really, really bothering them and affecting their lifestyle. But look, it goes on. Sleep apnea. Who would have thought that a disease could cause sleep apnea? Like, how does that work, right? And so it's because it causes central sleep apnea. It actually tells your brain you shouldn't breathe that much at night, which is quite disturbing. So again, these are things that we're looking at going, wow, this is concerning. How long does it last? Well, the WHO says long COVID starts 3 months after initial COVID and lasts at least 2 months. So everyone you think that was down and out for 2 months or 3 months, that's not long COVID. Long COVID is past that point. So imagine all the people that were out for 3 months that were not included in these statistics. So how long do they last? Well, it can last months, weeks, or even years. And it's very unpredictable. What's interesting is they said that 2/3 of people that had symptoms at 4 weeks were fully recovered by 12 weeks. So 1/3 of people were not, which is concerning. And some people even went on to have severe disease like chronic fatigue syndrome and myalgic encephalomyelitis, which is a mouthful. Basically, they're so wiped out and they have a form of encephalitis in their brain and they can't function. The question is, what's driving this? And even in Scotland, there was a pretty large population study, 42% of respondents had not recovered at 6 to 18 months, and 6% had not recovered at all. So, what does this mean for us? And again, this anxiety thing is so disturbing, but they did a study on 17 million people. 275 studies were analyzed in a meta-analysis, and 23% had anxiety and depression. That's gonna really upset our economy. Before COVID, 8% of the 8% of the world, or sorry, 8% of the United States had anxiety and depression. Well, what is that doing to our telehealth, mental health? Well, it's increased tenfold. We're using telehealth mental services 10 times more than we used to. And we're spending on health services in general 53% more over a 2-year span. So, conservatively, 1 in 4 patients that had COVID had anxiety or depression. If 140 million people had COVID, that means 33 million now have depression or had depression at one point since 2019, which means 1 in 10 people in the United States had crushing anxiety or depression post-COVID. That is quite disturbing. If we're seeing people try to assassinate the president, we're seeing all sorts of weird things, could that be long COVID? We have to ask ourselves these questions. Post-COVID sleep disorders. What's going on here? In 27 studies that analyzed 15,000 patients, we saw 45% of them having sleep disorders. That's half of the people. That is really not gonna help people feel good. Insomnia was the main issue, the main culprit. People ask yourselves, why are you so fatigued when you have COVID? Probably because you're not sleeping. And sleep disorder breathing issues with sleep apnea. There are a couple sleep apnea experts in this room. So if you guys need more assistance in figuring out whether this is an issue, we can get that done. Night sweats. A lot of my patients are saying, Doc, 3 months ago I had COVID and I'm waking up drenched. And this is not hot flashes. These are in men and women. It's COVID. So what about this one? Just feeling like you're choking or you're asphyxiated in the middle of the night. That must be quite an unpleasant experience. 36% of people experience that. Restless leg syndrome. In my practice, I have seen this myself really skyrocket. Why? Because of COVID. Sleep fragmentation and frequent arousal. So I think everyone knows, but if you don't, you know, your average sleep cycle is about 90 minutes, right? So about every 90 minutes, you'll have light sleep and you may wake up out of that. The first half of your night, you have deep restorative sleep. The second half of the night, you have lighter dream state sleep, which is why you wake up out of your dreams normally. Well, what if all of a sudden you had sleep fragmentation like a patient with sleep apnea, and now you're cycling every 30 minutes instead of every 90 minutes? Well, good luck. You're not going to get deep sleep. You're not going to get REM sleep. You're going to wake up every hour. You're going to be miserable. That's what we're seeing. So sleep quality has been deteriorated. Circadian rhythm sleep disorders. Just getting to bed on time is going to be a problem. Waking up on time. I have so many patients that are post-COVID say, Doc, I just can't get up anymore and go to the gym. I used to get up every day at 5 in the morning and go to the gym. Now I can't wake up till 8 o'clock in the morning. I haven't seen too much sleepwalking, but apparently this has been reported, and night terrors where you wake up in the middle of the night screaming bloody murder. It's disturbing. Central disorders of hypersomnolence, again, central sleep apnea. Let's put this in perspective. Let's talk about money now. That's what we're here to talk about. So 2019, the US spent $3.8 trillion in healthcare, 21 trillion total GDP, so the 17% of our GDP was from healthcare. 2 years into the pandemic, that number jumped to 4.5 trillion. But because our GDP also went up, it was about right. The GDP did not, the total spending did not change. Now, of those dollars, we know that 90% was chronic and mental health conditions. Mental health now being a big burden because of COVID likely. So let's jump forward to 2023. The number jumps again to 4.8 trillion. So now we're starting to get a little percentage increase here in healthcare, and this trend needs to continue to be monitored. What I think is fascinating is how you break this down. Check this out real fast. Medicare, 900 billion. Medicaid, 800 billion. Can you go back one slide? Thank you. Out-of-pocket spending, 400 million. Private healthcare insurance, 1.2 billion. 1,000 billion, 1,200 billion. And then when you look at the actual categories, you have hospital care being the most expensive at 1,300 billion, 1.3 trillion. Physician and clinical services at 800 billion, and prescription drugs at 500 million. When you break it down, which I think is really interesting, into disease categories, this is where it really enlightens everyone. Obesity is the #1 diagnostic spender that we have right now. We spend $500 billion a year on just obesity. And everyone says, well, heart disease and stroke is the #1 killer. It is. But how much we spend on that? About 300 billion. What about cancer? 200 billion. Diabetes, 300 billion. And Alzheimer's, 300 billion. So obesity takes the cake. No pun intended. So when I saw this, I said, well, what is COVID doing? How's COVID, comparing to this? It's at 50 billion, is it 100 billion? Well, I compare this to COVID versus obesity. Everyone thinks that obesity is gonna win, but COVID ended up winning. So, COVID costs approximately $700 billion a year. I just want you guys to think about that for a second. When anyone says, does long COVID really do anything? The numbers don't lie. It is the worst disease that we have ever faced so far in our economy. That's concerning. This is coming from the HHS. In 2019, their initial estimate was 2 trillion. And in 2022, they said, oh, we messed up. It's $3.7 trillion that we're gonna spend on long COVID, not acute COVID, on long COVID from 2019 to now, 5 years later, 2024. So this is taking into account, healthcare costs, reduced earnings, reduced participation over a 5-year period. So again, quite concerning. And these are obviously estimated as all the numbers are estimated by the best institutions. 1 million people are approximately out of work, which is only 0.5% of the population, but still, that costs us $50 billion in lost revenue. So if you think about it, 700 billion, only 50 billion of that is lost revenue. So we're taking into account a lot of financial costs here. It's costing the average person $9,000 a year to treat their own long COVID. Not to mention, we haven't even thought about disability claims now, and that's gonna affect our economy over the next 20 years. So I like to go down negative spirals and then follow it by a positive spiral. So what is long COVID? Let's get to the meat. What is long COVID? Well, traditionally, it's a post-inflammatory syndrome that some people call hyperinflammatory because it's something we haven't seen before. It's treated supportively, okay? Which that means is the doctor says, hey, just feel better, take it easy, and over time, you'll get better. You get routine labs when you go to a doctor. You get a routine x-ray, because if you're short of breath, they want to make sure your lungs are okay. If you had ARDS, they want to make sure you don't have lung scarring. If you're complaining of chest pain, they'll do a stress test. And they assess functional mobility with a 6-minute walk test. Individualized and structured, and it's very, pretty basic, I call that. So if you have anxiety, depression, they give you psychiatric care and counseling. If you have chronic fatigue syndrome, they will put you on antidepressants like Cymbalta. They'll tell you to eat healthier. And here's the most concerning statement here. There is no evidence for the use of specific pharmacological agents in the treatment of fatigue related to COVID-19. In some patients, we recommend Adderall, Provigil, or modafinil, and amantadine, which are neurostimulants. So if someone has diabetes, how many medications do we throw at them? If someone has Parkinson's, how many medications do we throw at them? If someone has obesity, If someone has any disease, we throw a ton of medications at them. We do not have any pharmacological intervention for long COVID. That is a missing link to a very expensive disease that's viral in origin. It gets very interesting. So let's keep moving. Again, traditionally, conserve your energy. Stay at home and play video games. I don't know. Somehow we think you're going to get over this. This is where it gets even more peculiar. They're going to tell you to sleep on time. They're going to tell you to manage your stress and regular movement. But again, it's so basic. This is what a child would tell you. A child would say, hey, mom, take it easy. Just relax. Order food. Walk around a little bit. This is nothing a professional should be telling someone if we have more information than we are actually admitting to. So again, we could do far better. Now, we have to understand the pathogenesis for long COVID to understand how we can fix this problem. The concerning thing is these are all the hypotheses, and none of them have been, quote, robustly proven, but I'm going to challenge that statement with all the data I'm about to show you right now. Viral persistence is the most concerning, plausible hypothesis here, because if we actually have viral persistence, well, guess what? None of the other things are going to get better. The virus-induced inflammation, the cellular injury, the coagulopathies, the gene expressions, we're activating genes that cause more inflammation. It's not going to get better. We know that it messes up your microbiome in your intestines. We know it causes autoimmune disease. I don't know if you guys have seen or heard of patients that all of a sudden have these very, very severe autoimmune disease, but it's happening a lot. Autoimmune priming is real. Immune dysregulation, that's a basket, guys, that's a really big term. If your immune system is dysregulated, you can't fight viruses as well. You can't fight cancer cells as well. So that's a really large statement. Reactivation of certain viruses. I have seen so many patients with reactivated Epstein-Barr, PCR positive, early antigen positive. We're talking rampaging levels of Epstein-Barr. Is that a problem? Well, everyone in this room has had exposure to Epstein-Barr, most likely. 99% of you, at least. Well, if it's active, it can cause cancer. It can also cause autoimmune disease. So these are things that we shouldn't take lightly. Well, neurological signaling dysfunction, that's evident in all the sleep disorders and sleep breathing, all the issues we're seeing. So this is a study that I want to talk about. University of California, San Francisco published this in 2023. When they took patients with and without long COVID symptoms, they found that a large proportion of them had positive COVID RNA in their bloodstream and in multiple organs of their body, including the brain, spinal cord, bone marrow, the nasopharynx, the lymph tissue in the chest, the heart, the lungs, and the gut, up to 2.5 years after infection. So is this theoretical? Well, let's look at Harvard. Last month, literally hot off the press, they took 1,500 blood samples, and they have a really, really sharp technology called Simoa technology, which is an ultra-sensitive test for detecting single molecules of COVID RNA and spike protein. And guess what? 43% of people that had long COVID had detectable positive viral proteins in their bloodstream up to 14 months after COVID. And even in the patients that did not have any symptoms, this is very concerning, guys, 21% of those had this viral persistence in their bodies. So should we be concerned about this? Well, what is dysregulation of the immune system? So we know that COVID-19, the reason it's so powerful, and by the way, we don't know where this thing came from. This thing is a powerhouse. There are a lot of theories. Is it lab grown? Is it coming from a bat? Or is it coming from who knows where? Regardless of where it came from, it is not normal. It can cripple your immune system by stopping interferon. Interferon alpha is what kills viruses and kills cancer cells. So COVID stops your body from making interferon, so you can have COVID replicate. It also inhibits your body's recognition of viral RNA. So your body literally is blind to viral RNA, AKA all these other viruses are being replicated in your system when you're sleeping and you don't feel so well. And by the way, do you guys know how many viruses are in your body? In your human virome? Do you know how many viruses? There's 320 trillion viruses in your virome right now. Most of them are latent. That means your body is keeping them down. But now here comes COVID. You can't see them anymore. Those viruses start to replicate. You guys see the problem now? It's very scary. Now, there's something called adaptive immunity. Your body sees a pathogen, creates lymphocytes, it kills them with cytotoxic T cells. Well, now we have functional exhaustion of these T cells because COVID is staying in the body. You're worn out. Your troops are all depleted. So this is really concerning, guys. Now, also, everyone knows that COVID is hyperinflammatory. That's definitely real. So when you have prolonged inflammation, that can cause all sorts of other problems, especially neurological issues, because your brain does not like inflammation. This is why 70% of people, up to 80%, had brain fog with long COVID. We talked about depletion of immune cells. Here's all the data from all the studies. Now, if you have depletion of immune cells, these are the exact pathogenic bacteria, viruses, and funguses that we're at risk for with COVID-19. All of a sudden, we're at risk for all of these things. Well, Aspergillus, Candidiasis, Cryptococcus, Mucormycosis, CMV, Epstein-Barr, HSV, Pseudomonas, E. coli, Acetobacter, Pneumocystis, Toxoplasmosis, and strongyloids. This is actually similar to what happens to AIDS patients. When you have AIDS, you have less CD4 cells. This is actually mimicking that in certain individuals. It's not as severe, but it's mimicking it. So also this is an autoimmune disease risk, like we talked about. So this, a two-country study in the Annals of Internal Medicine found that COVID-19 patients had a 30% increased risk for new onset autoimmune inflammatory rheumatic diseases. That means rheumatoid arthritis, MS, ulcerative colitis, inflammatory bowel disease, Hashimoto's, psoriatic arthritis. There are a list of autoimmune diseases that are now on the bench. Why? Because of dysregulation. Another study with 354,000 patients showed a significant elevation in multiple incident autoimmune diseases. And another study on 5 million adults found the incidence of autoimmune conditions 6 months to be significantly higher in the COVID-19 cohort. So, cancer, let's talk about that. Is this real? Is there a hypothetical link between cancer and COVID-19? Maybe. We know that chronic low-grade inflammation is a driver of oncogenesis. And we know that T-cell depletion can cause oncogenesis. And there are oncologists raising the red flag saying, we are seeing, quote, turbo cancers in all these young patients that were not present before. I got a call last week, 20-year-old woman, stage 4 colon cancer. Why are we seeing these very odd cancers? Is it related? We need more data. The data is going to come late, but we're going to get it. So, I mean, everyone's been talking about this. Even Fortune posted an article about this because the research is supporting the cause. There's a lot of people talking about this. This is the oncologist I mentioned that was talking about the turbo cancers that he's seeing right now. Now, if we are going to allow a virus to sit in our body for 2.5 years, potentially, this could cause a lot of problems, right? The longer you have immune dysregulation, the more you're at risk for cancer. It makes common sense. And because we're just giving people the tincture of time and saying, just give it some time, you'll be better, this is the wrong approach, guys. COVID-19 needs to be hit more aggressively. Why don't we have more antiviral medication research? There's very, very few antivirals that are any good. There's valcyclovir, that kind of helps a couple viruses, and that's about it. There's not enough money being poured into antiviral research. We have anti-inflammatory medications, but the problem with most of the anti-inflammatory medications is that they lower your immune system further. We need things that kill the virus directly. This is where I put my functional medicine hat on. I say, okay, what can I do? What kind of research is there around the world? What are other countries doing to do something better? Well, I can tell you right now that the American diet's not any good. And if you eat an anti-inflammatory diet, you're gonna feel better. If you eat more fish oil, I actually measure about 100 to 150 biomarkers on all my patients every 3 months. So they love me, but they hate me because they have to do like 40 vials of blood. But what I can tell people is, look, your CRP is dropping, your ESR is dropping, your TNF alpha necrosis is dropping because of fish oil. Fish oil is like the unsung hero of anti-inflammation. Or just eat fish. Eat wild salmon 5 times a week. You're gonna have a massive drop in inflammation. Gut health. We know that the microbiome is driving a lot of inflammation. I don't know if you guys know this, but 70% of your immune system in weight is in your intestines. You think about it, you got 26 feet of intestine that has to block all that toxic waste from entering into your bloodstream. You have hairs, patches, and all these white cells. So if you're eating an inflammatory diet, you're not gonna help your immune system at all. And if you don't have enough probiotics, you're not gonna help your immune system at all. So you need probiotics, you need an anti-inflammatory diet. This is pretty basic in functional medicine. And then what about supplements? All right, so I can talk to you guys about supplements till my face turns blue, but unless I show you the evidence, you will never believe it. These supplements are very powerful. Vitamin D, a methylated B complex, which means it's activated. Like in nature, when you eat folate, which is B9, it's activated, it's methylated. So never get a B complex that doesn't have methyl B complex, you're wasting your time. If it just says folate, don't buy it. You want methylfolate. Vitamin C, we'll talk about that. Resveratrol, if you guys don't know enough about resveratrol, I will school everyone here on resveratrol today. It's gonna be incredible. Melatonin, incredibly powerful at circadian resetting. Zinc, obviously for the immune system. Probiotics, you need about 50 billion CFUs. I like using a spread of like 3, 4, 5, 6 different strains. And I like my patients to rotate probiotics. You should rotate them every couple months. Okay, let's talk about vitamin D. Well, we know that in acute COVID, if you survived it and you had low vitamin D, you had a lot higher chance of having long COVID. Well, that's a shock. Why? Vitamin D is not a vitamin. I don't know if you guys know this, but vitamin D is a steroid. What are other steroids? Prednisone. So if you have vitamin D in your system, you have less inflammation. Everyone knows if you get inflamed, take some prednisone. That's extremely powerful, but vitamin D is a natural form of a steroid hormone, so it reduces inflammation. So that's a common sense, easy thing to do. By the way, getting sun is not always enough. They did a study on surfers, Hawaiian surfers, and 1/3 of them, Caucasian surfers from California, surfed the entire summer, were bronzed. 1/3 of them were low in vitamin D. There's actually a genetic SNP, and some people have it, 1/3 of people have it, where you can't take sun and turn it into vitamin D. Instead, you make more cholesterol, which is a precursor of vitamin D. So you go out and get some sun, and you just have high cholesterol now. That's what we're seeing in 1/3 of patients. And I actually, when I check people's genomics, I can identify that gene and say, yep, you have that gene. So another study showed that if you had low vitamin D hospital discharge, you had a higher likelihood of having long COVID, especially brain issues. So if you like your brain, get your vitamin D level optimized. And remember, the level normal is like 30 to 100. 31 is not good. If the normal is 30 to 100, shoot for like 60. Shoot for the high end of normal. And again, another study showed that you had higher readmission rates if you had low vitamin D, which makes sense. Vitamin C, let's talk about that for a second. Why does everyone think, now in evolution, we actually used to make vitamin C. Humans actually used to create our own vitamin C 2 million years ago, and then we lost that in evolution, so we no longer create vitamin C. Bears and wolves create vitamin C. And they've actually done studies on these animals, and Linus Pauling, he did a lot of studies on this. He figured out that these animals had less inflammatory conditions than we did because of their levels of vitamin C. So anyways, why do you think vitamin C helps? Well, we know it's an antioxidant. What does that mean? Oxidant just means inflammation. So if you have less oxidation, you have less inflammation. COVID is inflammatory, it makes sense. Take vitamin C. We know it helps with endothelial support, which is blood vessel support. We know that COVID destroys your lining of your blood vessels and the laminate propria, so this is really important. This is a study, actually, it's pretty interesting, that they gave people IV vitamin C, because everyone says, oh, what about IV vitamin C? I see these clinics and they give IV vitamin C. Is that any good? Well, let's look at the data. So this is an interesting data from 2022. And they said here that they had 1,500 patients with COVID-19, and that if they did early treatment with IV high-dose vitamin C, it seemed to reduce the risk of severe course of action, severe diseases such as pneumonia, and reduce mortality. Now, this is an observational study. It needs to be followed up by a more robust study, but that's still promising. Now, let's talk about good old resveratrol. Have any of you guys been to Sardinia in Italy? It's a little island with a blue zone. It's very famous. People often live over 100, and it's because of their wine. So if you go to Italy and you drink a glass of wine, you'll notice it obviously tastes different. It doesn't have sulfites, less preservatives. Beautiful glass of wine, right? And so when we went to Sardinia, we were asking all the locals, what do you guys drink? How much do you drink? And you know what the little women would tell us? The women that were in their 80s? We drink half a glass of red wine with lunch and half a glass of red wine with dinner. So they weren't drinking more than 1 glass of red wine per day. That red wine contains resveratrol, which is hugely beneficial. It's called a phytomedicinal compound. So it is, talk about making you live longer. That's exactly what it does, and that's why there's so many centurions in Sardinia. We know it's anti-inflammatory, but this is interesting. It can actually inhibit COVID-19 replication in cell cultures. So when they did in vivo studies, resveratrol stops COVID from replicating. I'm like, wait a second. Are you telling me I should drink red wine when I have COVID? No. Alcohol will reduce your immune system. So what you need to do is take resveratrol without the alcohol, okay? And that would be the perfect balance. So that's interesting, right? But guess what? It does more things. It activates these genes called sirtuins. Do you guys know what the sirtuin genes are? They're very famous. They can regenerate your body. They're called the famous anti-aging genes. So anything that activates the sirtuin genes is really where you're going to want to focus on. Resveratrol is one of the most powerful things to modify gene expression. So here's interesting. Is this good data or bad data? Well, you tell me, it's a randomized, double-blind, placebo-controlled trial. That's the best gold standard study you could have right there. And they used COVID for mild COVID, obviously because it was severe, they'd be in the hospital. And it was a phase 2 study. And sure enough, the patients that were treated with resveratrol had a lower incidence compared to placebo of hospitalization, ER visits, and pneumonia. Guys, take that study to the bank. That's massive, guys. So who has ever thought about taking resveratrol for COVID? It's not a common thought. So there are certain companies that I really think have the best resveratrol in the world. This is one of them. So just so you guys know, 99% of resveratrol comes from Japanese knotweed, which is a cheap way of getting this product. Because I don't think you can go to a vineyard in Italy and say, hey, I want to take all these grapes, put them in a capsule, and charge the person $2 for the capsule. They would slap you. They say, get out of my country. So this company, so the person who created the cable modem, his name is Zaki. He's a very, very intelligent Israeli. He's a billionaire. He put $100 million into bioreactor technology in Israel. So right now, they can actually take any phytonutrient that's normally, it takes an insane amount of land to grow, and put it in bioreactors and grow the exact same perfect bioidentical chemical in an insane yield. So for the first time in history, we can create Pi-Sid resveratrol, which is 98% soluble, versus everything out there in the country, which is 4% soluble. So what does that mean for us? That means that for the first time in our life, you can have a full bottle of red wine as if you were in Italy with no alcohol, no sugar, with all the benefits. So this is a huge, huge deal. And I have used this product for 4 years. I have hundreds of patients. Now remember, I get so many offers by so many companies, so many supplements on a daily basis that it's nauseating. So what I do is I take one supplement at a time and I say, is this real? Is it backed up by science? Is it third-party verified? And then on top of that, Does it actually do something for my patients? Does it change biomarkers? What I can tell you is that I have seen significant changes in biomarkers. That's all proprietary. I actually reached out to the company and said, we have to run a clinical trial. I'm now one of their scientific advisors because we're running clinical trials based on the data on my patients. The only reason I know about this is because one of my good friends, who's a Johns Hopkins oncology researcher, calls me and says, hey, this product's gonna change the world. And I said, really? How's that gonna work? And so when he explained to me, I said, that's interesting. Now, there is a large Ivy League institution that's taking this product and adding it to cancer immunotherapy studies right now. So this is like not normal resveratrol. It's actually doing what it's supposed to be doing because we're for the first time in the world, we actually have an absorbable version. And this, by the way, it's patentable. That makes people go, oh, really? It's patentable? This is a patentable phytomedicinal compound, which is identical to resveratrol, but because of the technology involved, so all of a sudden we're having multiple investors, multiple people interested in this, and the studies there's a lot of studies and they're gonna keep rolling out. So this is really exciting, guys. I would suggest everyone on this place, everyone here takes this for two reasons. Number one, it's anti-aging, which is, if you wanna live a long time, that's number one. Number two, it has anti-COVID activity, it has anti-inflammatory activity. Don't leave home without it. So, what about melatonin? Oh, melatonin, costs like, 10 cents. It's been around for 1 million years. Does it do anything? Well, you make most of your melatonin when you're about 14 years old, 15 years old. By the time you're 30, you're only making like 20%. By the time you're 50, 60, you're barely making anything. Is it important? Well, if you guys Google melatonin, inflammation, PubMed, and you see all the studies, you're gonna go, wow, it's really anti-inflammatory. But also, it also has significant anti-cancer properties. I just want you to research this on your own and you can see what I'm talking about. And it also helps regulate your sleep. So it doesn't really like put you to sleep, but it helps your body know, okay, this is this time for me to go to sleep. Now, some people are very sensitive to melatonin, and when you take it, it knocks them out. And other people, they feel nothing. But I would tell you is that even if you feel nothing, you know it's helping you because your body still says, okay, this is my sleep time, whether it be 10 o'clock or 11 o'clock. This is another study. So melatonin, anti-inflammatory mitochondrial savior in long COVID-19, showing that there's a lot of clinical outcomes that are improved if you use this, reduced hospital durations. And even though these trials are small, and albeit most of these studies are small because they're not backed up by pharma, so we don't have $1 billion for phase 1, phase 2, and phase 3 studies. But when you look at the data, it's still significant in my opinion. So, what about probiotics? Do probiotics actually do anything? Well, they did another randomized double-blind placebo-controlled trial with 463 patients. And then if you took this mixture called symbiotic, which is prebiotics and probiotics, and if you had bifidobacterium strains, yep, they had improvement in fatigue, memory loss, concentration, GI upset. So that's another great study you can take to the bank. And by the way, a good prebiotic is inulin. It's so cheap. You can take 1 scoop at night and it basically triples the existence of your current bacteria. Another study here in Hong Kong, they did a symbiotic preparation. I'm sorry, this is the same study. This is the actual study in Hong Kong, which is pretty awesome. What about omega fish oils? Like I talked about, it's very powerful, very anti-inflammatory. This is interesting. If you guys, I'm sure most people in this room know about zinc and COVID-19, but if you didn't, they did a randomized control trial that showed that if you took zinc during COVID, you had significantly reduced 30-day mortality, ICU admission. And we know that zinc is antiviral, but we also know that it blocks the ACE2 receptor, which is how COVID binds to your cells. So this is really fascinating. And if COVID is sticking around, take zinc. It makes sense because it's antiviral and it blocks the receptor for which it basically activates everything bad in your body. It kind of makes sense. Now, I used to have a facility where I owned multiple hyperbaric chambers. This gets really interesting. Now, if you guys don't know what hyperbaric oxygen is, it's basically a pressurized tube with air, obviously, and we put 100% oxygen in it, and then we pressurize it to, on average, 2 atmospheres. We're all at 1 atmosphere here. So if I pressurize you to 2 atmospheres, it's like everyone's 35 feet underwater, which then that takes the oxygen gradient and multiplies it so you have 10 times more oxygen at that pressure than you do here at room air. So what does that do to you? Well, oxygen does a lot of really interesting things. It activates stem cells, which is why it heals a lot of different conditions like third-degree burns, diabetic foot ulcers. It creates new blood vessels. It can do all sorts of very interesting things. It's great for traumatic brain injury. But then also, there's been multiple studies showing that it helps long COVID. This is one from London. They took 10 patients that basically were the worst of the worst. They all had depression, fatigue, brain fog, joint pain. I mean, they had every symptom. They put them in for 10 treatments, and at the end, there was significant improvement in all of their scores, their fatigue, their cognition, their executive function, their attention, their information processing, their verbal function. All these neurological issues were significantly improved. And that was only 10 patients. But then Israel says, we'll step it up. We'll do a study with 73 patients, and we're going to make it a double-blind controlled trial because Israel has higher standards. And what did it show? Boom, same thing. Significant improvement in energy domain, psychiatric symptoms. So when I saw this and I had hyperbaric chambers, I said, let's try it. I had patients lined up for months because they would tell their friend would tell their friend, and we never even advertised. And we had, our hyperbarics were completely full. So it works in my opinion, anecdotally extremely well. Now, this is a little controversial thing that I like to talk about. Methylene blue. If you guys are true Americans, you'll like methylene blue because the flag is dyed blue with methylene blue. Methylene blue is a dye. It's what we use for blue jeans. So Americans like blue jeans. Americans like the American flag, right? But what else is methylene blue? Well, it's actually an FDA-approved medicine that is used for treatment of methylglobinemia and cyanide poisoning and carbon monoxide poisoning. So the only time you'll see this in a hospital setting is someone's, about to die from carbon monoxide poisoning or cyanide poisoning. But it was one of the first antibiotics used in the 1800s. The entire US Navy actually took this at one point. And because it's a blue dye, it would make you pee blue. And so they had a saying, the Navy would pee blue in the loo, because the entire Navy was taking this. So it's been around for a very long time. The only contraindications is if you have a rare disorder called G6PD deficiency, which is about 1 in 1,000 people, or if you're on a really high dose SSRI or psychiatric medication because it can increase serotonin levels. Those are the only 2 contraindications. But here's the interesting part. It kills COVID really quite well, according to these limited studies. So this is Nature. Nature is the second best medical journal of about 30,000 medical journals. Here it is, talking about methylene blue in vitro with H1N1. So the flu and COVID both were destroyed by methylene blue. So methylene blue has extremely exceptional antiviral activity. And in the past, they thought we used to have to activate it with UV light, but even without the activation, it worked really well. So then I looked and said, well, does any country in the world actually have a good study? And here's one where they actually took, in the Middle East, they actually took methylene blue and treated patients in the hospital that were in the ICU, randomized control trial, highest level of evidence. And what happened? Shockingly, they got off the ventilators easier. Their oxygen levels were returning to normal faster. So they have significantly improved oxygen levels and respiratory distress with this product. Now, I want to just say this. We have a lot of things that we don't use currently. Other than, quote, supportive care and a tincture of time, we're really not doing a lot for our patients. There are a lot of doctors around the world that are using alternative treatments with phenomenal success. Why are we not studying these things? If this is a financial impact that we're having, why aren't we not creating better medications, pharmaceuticals, antivirals? There's so many things we can do. Maybe, if Paxlovid is a really potent antiviral, why don't we use it longer term? Why do we only use it for 3 days or 4 days or 5 days? Why aren't we using it once a week for 4 months? Why are we not thinking outside the box? Why are we not taking the viral persistence model, which has been proven by Harvard, UCLA, So many different institutions, why aren't we studying this? If it's impacting our economy this much, it's causing so much mental disease and so, I mean, this is really, how is that gonna affect our military? If 1 in 4 people in our military have anxiety and depression, what are we doing? You want PTSD? There you go. Now you have PTSD. Now we're gonna have all sorts of problems. So if we want a strong military, we need to address this. We need to think outside the box, and this needs to evolve. We need to step it up. That's my point here. I think, and I have a lot of practitioners like myself that have had phenomenal success in long COVID patients, thinking outside the box, using these strategies. We need more data, and I'll leave it at that. Thank you guys very much. If you guys have any questions, I could take a question or two. Up here, up front, yeah.
Amongst our primary care networks. I mean, I have a master's in nutrition, and when I started, I preached this all the time, and it wasn't really effective because it wasn't focused at something. And I like this idea, neurotoxicity, inflammatory, we never address it, but we know cardiac, everybody has high inflammatory markers, and what do? I mean, there's not much, right? So I think you're right on, you're spot on. It's I think maybe you're the top 1 or 2 lectures I've heard in the last 6 months. That makes sense to me. And, I'm going to probably want to know more about this because it reawakens those years of getting a master's in nutrition and finding out nobody wants to use it. Yeah.
Yeah. No, I appreciate that. I agree with you. I think the way you have to be scientific and objective. So I measure an incredible amount of labs. And when I prove that these labs are improving with therapies, then I drive the point home because people need to see objective data. They need to feel better. They want to feel better, but they also want to see their labs changing. So that's what I would suggest. If we're using vitamin C, if we're using all these nutrients, I measure all their vitamin levels before, I measure all their inflammatory markers, and I follow that over time. And you see such a drastic improvement that it's crystal clear. Yeah.
So with the resveratrol, is that water soluble or fat soluble to get the nutrients?
Resveratrol?
Yeah, is it water soluble or fat soluble?
Fat soluble.
Okay.
That should be best taken with a meal, at least 8 grams of fat.
Okay, so with that, should they also be incorporating like avocados or something like that, or an oil?
Oh yeah, you definitely want anti-inflammatory oils,
Okay.
avocado oil, olive oil, the good oils, absolutely, yeah.
Perfect.
Staying away from canola. And I'm hopeful that the new political situation that we have right now in the United States, there are a couple of people that will shake up the system right now and wake people up to some of these therapies as well.
You raised a really very interesting question. So when you look at the, look at the healthcare overall, so what's medical school and the practice really focus on is sick care, right? Nobody address health because there's no CPT code, right? There's no reimbursement.
Yep.
So the question is, from your point of view, you do both, right? So how do you think we need to change this, right? More preventive, more functional, more health-driven approach, which lead to value-based care. That's what the value is.
So the Cleveland Clinic is tackling that right now. So Dr. Mark Hyman, who's a director for the Cleveland Clinic, has done several large trials showing that if you invest more in prevention up front, you save, it's like, the old saying, right? An ounce of prevention is worth a pound of the cure. It's very true. So if you invest, I think it was an average of $2,000 to $3,000 on extra preventative things up front, more labs, more diagnostics, you saved, I think it was $40,000 over 1 year on average per patient. So there's definitely cost analysis that can be done, statistics that can be run, studies that can be done. And Cleveland Clinic is starting to spearhead that right now. And I really hope that becomes more of a thing now because the cost consequences is out of control,
First question is to answer your own question. Why do you believe, or what do you believe is the reason why alternative therapies are not being used in the United States? I mean, I believe I know the answer, but I'd like to know what you think. And the second question is it possible, because I've seen research on it, long COVID is really long vaccine induced?
So I'll answer the vaccine part first. I don't think there is as much long vaccine as we think, because when you, and again, I have limited research on this, but when you give someone a COVID vaccine, their spike antibodies go up for about 6 months, and then they drop to almost zero. So I know that the spike antibody is low, which means the spike antigen is no longer being produced at about around the 6-month mark, which is why they're saying you should get vaccinated every 6 months to keep the antibodies elevated. But what I can tell you is that when someone gets COVID-19, that COVID antibody is up for years, because, and I think it's because of viral persistence. The virus is not leaving the body. So that's complicated, and there's a lot more data that can be done on that subject. The reason why this is not standard of care is fundamental medicine. In a nutshell, we have democratized the medical system, right? This is a money-making financial situation, right? So if we don't know a clear way of making money, then people are not interested. A lot of people don't know how to do this correctly. I have a different practice because I took over a private practice that was mostly cash-based, and so we had a different way of kind of getting around that. But there will be a way where everyone, the payers, everyone can get involved. Now that, and by the way, now that we have patentable phytomedicinal compounds like resveratrol, this is going to be a game changer, because now people are going to want to get invested. People are going to want to throw $1 billion at a trial because you can make money now off these products. So I think that's probably the future. If we can just patent these phytonutrients, now all of a sudden we can push nutrients that have minimal side effects, maximum positive outcomes, and really push the needle. And by the way, Samantha over here on the left, I just want you to wave. So she actually, I had her come, she actually works for BioHarvest, the company that I'm talking about. They're creating bioreactors, not just for Vinia. They're going to start licensing bioreactors for all these phytonutrients. So imagine you're a pharmaceutical company and you go to the Amazon and you find a little rare chemical, but there's only 6 plants that make it. Good luck, right? And you need that chemical for your drug. Well, now they can put it in bioreactors and create an insane amount of this at a very, very cost-effective measure, organically, without pesticides, without herbicides, without an insane amount of water or land or labor. So we're walking into this so this bioreactor field is gonna really change everything. Because all of a sudden, imagine if you could take a pill that has 500,000 phytonutrients in it. I mean, how insane would that be, right? So we're about to become really futuristic, and I'm really excited about that. And then I think that democratizes the nutrients, and now it's going to come into the work. So I think it's going to work out. It's going to take a little bit of time.
Dr. Maristany, I really appreciate what you've said. This is one of the most interesting panels I think we've had. But you mentioned the blue zones, and you mentioned Sardinia. And there are other blue zones, Vietnam, Thailand. And I'm just wondering why these blue zones are not more promoted for American healthcare.
So I'm from Naples, Florida, and they are turning into a blue zone. So we actually have blue zones in the United States. I completely agree. I think most people that are health conscious know about the blue zones, but it's not spoken about enough. But if you go to Sardinia, I mean, I always tell the story, but I went to a pizza place. I had to have pizza in Sardinia. I normally am gluten-free, but I went there, and every person at that restaurant, every single person was rail thin. They're in their 40s and their 50s. And I went up to him and I said, "You guys eat pizza?" He goes, "Every day." I said, "Really? Do you eat pasta?" "Every day." I was like, "There's no way. You look like you're like a movie star, like Brad Pitt, like, in the movie where he's ripped with a 10-pack. How are you eating pizza and pasta every day?" So it's the fact that they're not using bleached flour. We bleach our flour. Do you guys even know what that means? When you get bleached flour, it's not that they actually add whitening to it. They burn it. They oxidize it. They make it age faster. If you're eating aged wheat, that has something called AGE, advanced glycation end products. That makes you get sick, makes you age faster, makes you have cancer. So we're literally burning our foods and handing them to you, saying, "Hey, this is a good piece of focaccia bread." Meanwhile, you go to Italy and it tastes very different because they didn't burn it. Rule number 1 as a chef, don't burn your food. So there's a lot of things that we're doing wrong. By the way, if you try to import bleached flour into Italy, you can't. They'll shut it down. That's like illegal. It's like putting cocaine in there. You can't do it. If it's unbleached flour, you can send it all day. So we got to change our standards, and I'm hoping that starts. I think RFK might shake things up a little bit and start to make the standards a little bit higher for America. Anything else?
Thank you, Dr.
It's been a pleasure.
Maristany.
Thank you, Nicole.